Taylor Nasland. Here is the room that we're in. Okay, so the first injection site is going to be the deltoid, and this is good for intramuscular injections. You will find it by locating the acromial process, going 3 finger widths down and making a V, and you will inject at a 90-degree angle right in the middle. Next is the dorsolateral. So you will find this by locating the deltoid insertion and going 3 fingers below that, and then 3 fingers above the olecranon process. And this creates a little rectangle. This is good for subcutaneous injections. You will do this at a 90-degree angle or a 45-degree angle. Next is going to be the abdomen. So this is good for subcutaneous injections. You want to stay below the costal margins and above the pubic area, and in between both the right and the left anterior superior iliac spines. To inject, you want to stay at least a 5-centimeter diameter away from the umbilicus, and that will give you a U-shaped area. And sorry if I tickled you. To do this, you want to go in at a 90-degree angle or a 45-degree angle because this is subcutaneous. The next is going to be the vastus, the ventrogluteal. There we go. And so you will find this by locating the greater trochanter. So you want to move the leg. I feel it right there. And then you'll put your palm on the greater trochanter, your thumb pointing towards the groin, and your index finger on the anterior superior iliac spine, spreading your fingers out, and this will create a V. You want to feel to make sure there is sufficient muscle, and you will go in at a 90-degree angle since this is intramuscularly, and this is also the preferred site of injection. Next is the vastus lateralis, and again, you will locate this by finding the greater trochanter, by moving the leg. You will go 1 hand's breadth below the greater trochanter and 1 hand's breadth above the knee, and ensuring that you stay midline, between the midline of the top of the thigh and the side. And so that creates a rectangle right here. This is good for subcutaneous and intramuscular injections, so you will either do it at a 90 for intramuscular or at a 90 or 45 for subcutaneous.